Men should know their body. Number one, they should know where the prostate is and what it does. Prostate is at the opening of the bladder and at the base of the penis. That's where it is. What does it do during sex? It feeds the sperm that is in the vagina. It provides fluid for the sperm to move in the vagina. That's what it does. Now, to be diagnosed with prostate cancer, it requires a biopsy. A biopsy is done either through the rectum or through the area we call in the perineum. That's just below the testicles and above the rectum. Now, once you're diagnosed, what do you need to ask the doctor? What you want to know is, how aggressive is this cancer, number one? And he will tell you about two different ways to measure aggressiveness. One is called the Gleason score. That's a score between 2 to 10, but we never see 2, 3, 4, and rarely do we ever see a Gleason score of 5. It's 6 through 10 are the Gleason scores that we see. And the 6 is what we call a low-risk prostate cancer. A 7 is an intermediate risk, which is now called unfavorable and favorable. So we divide that into a 7, 3 plus 4, meaning a favorable risk, 4 plus 3, meaning an unfavorable risk. 8, 9, and 10 are very aggressive cancers. So that's what they need to know, and the doctor will tell them that. In addition, they may want to know, doctor, do you think my cancer is confined to the prostate on rectal examination and by the PSA? And the doctor will explain that. On rectal exam, it feels like it's within the prostate, does not feel like it's outside the prostate. And the PSA level is important. If the PSA is greater than 10, the normal is 4. If it's greater than 10, that may mean that there's an increased risk of spread. If it's greater than 20, that risk of spreading is even greater. So the level of 4 is normal, but again, if it's less than 4, it does not mean you have cancer. You may have cancer, and it may be a very aggressive cancer. What we know is the cells of the prostate, when they're abnormal, when they're aggressive, they are very abnormal and don't produce much PSA. That's why you may have a low PSA with a very aggressive cancer. Now, they also want to know, what do I do now? Do I have it treated, or I watch it? People are talking about watchful waiting. That's when we don't plan to do any aggressive surgery. But active surveillance is when we plan to do surgery if the cancer progresses from a low risk to a higher risk. Also, on the day of diagnosis, you need to discuss with the physician your family history, whether it's a family history of prostate cancer or multiple cancers in that particular family. So this is the kind of information you need to discuss with the doctor on the first day of the diagnosis.